Last week we spoke about depression and anxiety in men, and this week we are getting a little bit more personal and discussing normal and abnormal discharges in men. Wait, they're normal penile discharges?
Don't stress when it gets hard. Gotta let go, let God. Gotta let go, let God.
Hi there, welcome to my channel, 𝐒𝐿𝐴𝐻𝒄𝒉𝒆𝒅𝒖𝒍𝒆. I'm Kim, also known as Dr. Good to All, and on my channel I explore health, lifestyle, and a ton of Jesus. And this and every Wednesday for the month of June, we will be discussing everything men's health for Men's Health Awareness Month. This video is all about men and discharges, and many men and women don't know the difference between normal and abnormal penile discharges. Heck, most people didn't even realize that there was a thing called penile discharges, and for that very reason we are going to talk about it today. So male discharge is any substance other than urine, of course, that comes from the urethra, also known as the urine hole or the pee hole of the penis. And there are normal causes of this and abnormal causes of this. There are 2.5, the third isn't really a discharge, but 2.5 causes of discharge in men that's normal: pre-ejaculate, ejaculate, and smegma, which I said really isn't a discharge, but it's more of a condition, but can result in an odor coming from the penis. And I believe that we really should talk about it as well, because discharges are usually associated with odors, so we're just going to cover smegma as well. Pre-ejaculate, also known as pre-cum, is a clear fluid made by special glands of the penis. These glands are known as Cowper's glands that sit alongside the urine hole, known as the urethra. So I'll be calling the urine hole urethra, so just grab onto that word and know what I'm talking about. And this fluid is secreted during sexual arousal predominantly, right? Pre-ejaculate helps provide lubrication prior to sex and clears acid from the urine out of the urethra, which is important to set the right environment for maximum sperm survival, because sperm cannot survive in an acidic environment. And even if you don't have the intention to be sexually intimate, your body responds to feelings of arousal or stimulation by preparing the penis with pre-ejaculate. And I just want to do a quick myth buster. Pre-cum, also known as pre-ejaculate, is chemically different from semen, which we will discuss a little bit later, but may still contain sperm. Therefore, it's important to use protection even if you are practicing the withdrawal method, because the risk of pregnancy exists without ejaculation. Alright? So keep that in mind. Use a condom every time, unless you are trying to get pregnant. Also, do you know what else is in this pre-ejaculate? Yeah, that's right. STDs can be in this pre-ejaculate, you know? And we're going to talk about that a little bit later, but I really wanted to just take this opportunity to drive home the point that condom use protection is super, super, super important. Right, so back to the point. Men can produce up to a tablespoon of pre-ejaculate or pre-cum, or even more. And this usually, again, happens during sexual arousal or stimulation. Ejaculate now is the whitish substance that is released during an orgasm, about 1 teaspoon in quantity, and this 1 teaspoon contains about 1% sperm, and the rest of the fluid is essentially sugar, protein, and enzymes. And in this 1% of semen, there could be up to 200 to 500 million sperm in that teaspoon. For some males, this number can vary, and those factors we won't be discussing in this video, but we definitely will discuss it in another video if you guys request it. The smell of this fluid is a minimal, usually in keeping with the natural smell of the male, and this fluid can vary in potency in smell, and also can take on the smell of your diet, especially that of fried foods. So it's so important to eat balanced meals and drink a lot of water to decrease the potency of the smell of this fluid. This also applies to the pre-ejaculate. Now, if the smell starts to kind of go off into another direction of malodorous and unbearable, then we know that that's not normal, and that's what we're going to talk about a little bit later. Speaking of smells, we're going to now talk about smegma. Now, smegma is a collection of oil and dead skin cells seen mainly in uncircumcised men around the tip of the penis and in the vaginal folds of women, and is usually happens as a result of our body trying to clean itself, which it does pretty great job at normally. And this smegma is normal, but it can build up over time and can increase even more with increased sweating from exercise or being in humid conditions. If smegma isn't dealt with properly, it can cause painful side effects such as irritation of the delicate skin surrounding those intimate areas that we spoke about before. This smegma has a distinct characteristic. Firstly, it's a thick cheese-like consistency. Again, I am no fan of comparing food to body parts, but this is a really accurate description. It really does have a cheese-like texture, right? It is white in color and can be darker depending on the skin tone of the male. So for our melanated men, this smegma can be a little bit off-white as well. It can have a very unpleasant smell, especially when it remains for a long period of time. So it's super important to maintain proper hygiene, which is the solution to this smegma, which includes gently washing the head of the penis. And for uncircumcised male, that would be found beneath the foreskin. All right, so it's important to pull back that foreskin and clean the head of the penis. And for our circumcised male, you just clean the head of the penis. But it's very important to really pay attention to your hygiene to prevent unwanted smells from arising in your groin. Now that we have really covered those normal causes of male discharge, we're going to now talk about the abnormal causes, and there are quite a few of these causes. Usually they're accompanied by inflammation of various parts of the reproductive tract of the male, which doctors have specific names for, from prostatitis, referring to inflammation of the foreskin, epididymitis, which refers to the epididymis, which is the tube that carries the sperm, and testiculitis, which you can guess that one, refers to the testes. Just to name a few of these specific names, but in this video I'm just going to call it inflammation to kind of really get the point home. We're not going to confuse you with no big word. The most common cause of male discharges would be sexually transmitted infections. Now, I went into an abundance of details of varying STDs in the Let's Chat About STDs video, so you can check that out. I'll also link it in the comment box below. Tons of detail for both men and women, but I will do a quick recap here. So firstly, let's talk about chlamydia, where only 10% of men with documented cases actually have symptoms. So it's important, if you're sexually active, to get routinely tested every 6 months, or if you recently changed your partner, because 90% of the time, right, you can have a sexually transmitted infection and have no idea, right? However, when symptoms in men are present, they can include urethritis, which is an inflammation of the urine hole, the urethra that we spoke about. And this discharge can be mucus-like discharge and or accompanied by pain or swelling in the testicles. So if you find that you have a mucoid or a mucus-looking like discharge, right, and you also have pain in the testicles, please find your way to a doctor. Prolonging treatment of any STD or any inflammation in the reproductive tract can result in a decreased ability to have children in the future. So it's very important to get tested frequently, and if you have any swelling or inflammation in the groin, to get checked out, because you can be doing yourself future harm. And reversing these complications in the future after the damage is done can be quite difficult. So the next STD I would really like to talk about today, which is probably the first thing I should have mentioned, is gonorrhea. Very frequently occurring and may have no symptoms as well. More likely to have symptoms than chlamydia. However, a lot of men who have this condition have no signs and symptoms, so it's important again to get tested if you're sexually active or if you're changing your partner. Men with gonorrhea usually experience a whitish, yellowish, and sometimes even greenish fluid coming from the tip of the penis. There's also associated pain with urination, and for some men there can even be swelling of the testicles. So it's important to really pay attention to your body if you see any of these signs to seek medical help. The third STD I would really like to talk about is the herpes simplex virus, which can also cause a penile discharge as well. Now, when these lesions, which are associated with herpes, it could be on the lips or it could be in the genital region. But when these lesions are in the urethral region, you are not only have an STD but also a UTI, which we're going to talk about next, a urinary tract infection, because the lesions are in the tract of the urinary system. And this can be associated with all the symptoms of UTIs, which we're going to talk about next, but also a penile discharge. So it's really important to be very in tune with your body. If you see any lesions, any burning sensations in or around the penis, it's very important to seek medical attention. Now, outside of STDs, causes of discharges in men are urinary tract infections known as UTIs. Again, I went in depth about UTIs in another video. I'll link below as well, so you can check that out for more detail. But quickly, UTIs are more common in women than they are in men, and the causes are predominantly bacteria from the rectum, but could also have a viral or even fungal cause, and we just spoke about those viral causes known as HSV, also called herpes simplex virus. All right. Signs of UTIs include a clear or pus-tinged fluid from the penis, feelings of urgent need to urinate, a burning sensation when urinating, urine that is cloudy and or foul smelling, which is one of the most common signs, and fever. Right? So you don't have to have all of these signs and symptoms to have a UTI, but any of these are indicative of having a urinary tract infection. Discharge is usually associated, or most commonly associated, with persons with an indwelling catheter, but can be seen in other individuals as well. And lastly, we're going to talk about allergic reactions. Now, this is not really a cause of discharges mainly, but worth mentioning because it does rarely happen and can be from soaps, lubricants, certain types of condoms, and medications. So you know, if you're using a specific type of condom and you find that you're getting a rash, getting itchiness, and you've done checked out that you don't have any sexually transmitted infections because you're getting tested after you change your partner in every 6 months, or if you find anything abnormal, right? That's when we're going to get tested, right? You're more likely to get a red, itchy rash, however, with an allergic reaction than you are to get a discharge. So it's just important, if you find anything abnormal down there, to go seek medical attention. Don't make it just sit down there. All right, it's very important. So now we're going to talk about when to seek help. I mean, we basically touched on this throughout the video, but we're going to just put it in a very concrete, clear-cut way so that you will not be confused about when to go seek help, because it's so important to seek help before damage that can be reversible happens. Okay, so any penile discharge that is not urine or related to sexual arousal, such as pre-ejaculate or ejaculate or even smegma, is considered abnormal and needs medical evaluation. So you can either visit your general practitioner or family doctor, or even a urologist if your penis is 1, red or irritated, 2, has a discharge that is discolored or foul smelling with or without sexual activity, and 3, if you're experiencing testicular swelling. I know many men are afraid of doctors, so let's quickly talk about what is going to likely happen at the doctor's office when you go to visit, okay? Firstly, there's going to be a quick medical and sexual history. They're going to ask about your symptoms, and there will be an examination of your groin, okay? And usually if you have a discharge, there'll be a very small cotton swab to acquire some of the discharge and be sent out to the lab for analysis. A script or a prescription would be given to you if needed. And that really brings us to the treatment, which depends on what causes the penile discharge, right? So for bacterial infections, they're usually treated with oral antibiotics. For fungal infections, such as those that result from yeast infections, are combated with antifungals, which can be a cream or an ointment, but they're usually topical treatments, can be oral as well. And lastly, with allergic irritation, can be calmed with a topical steroid, right? So a cream or an ointment as well. So this is basically what you're going to anticipate if it is that you do have a discharge or any penile issue and you visit the doctor's office. So I really want to encourage you to not be afraid and to seek medical attention so that you can just be healthy. You know, I really hope that this really helps you. I hope that you're well informed and found this video helpful. And that is it for today's video. Share this series with one of the men in your life. I guarantee you they will appreciate it. Thumbs up if you enjoyed this video, and comment below your feedback, any other topics you'd like me to discuss as per usual. And most importantly, don't forget your garment of love, for it always protects, trusts, hopes, forgives, and always perseveres. Until the next video, guys, shalom, shalom. Have a beautiful day.